All right, we're gonna start with Bonnie here.
All right, Bonnie, we have her at 8 o'clock. We are taking a final impression of her bridge on the upper right, number 4 through 6. No pre-med, no overdue family, and recall is scheduled. Her next appointment will be seat her bridge. 9 o'clock we have Kate. We're seating number 2, so we'll take a bite wing there. And then 13 MOD, no pre-med, no overdue family, and yes, recall scheduled. Her next appointment will be her cleaning. Then we have Sarah at 9:50. Yes, she is a pre-med, so we're going to take impressions for all those implant crowns, 4, 5, and 6. And then when we seat those, she had some abfraction fillings, so maybe we could do it at her next appointment. And then we have Kate at 11:20. No pre-med, no overdue family. Yes, recall is scheduled. We're doing 5DO. Okay. And her next appointment is her cleaning. Then we have Tim at 12. No pre-med, no overdue family. Yes, recall scheduled. We're doing 15 occlusolingual, and his next appointment will be his cleaning.
He's at 11 for a cleaning.
Okay, all right, perfect.
Exam on Dr. Chair.
Yes. Brittany, can you do some infiltration around 15 in the chair, please?
Yeah.
That'd be great.
All right, then we jump down to John at 3 o'clock. We're doing a crown on number 14 and a build-up, so we'll take a PA prior to starting. No pre-med, no overdue family, and yes, recall scheduled. We'll seat his crown at his next appointment. We have Veronica at 4, 5 DOL, no pre-med, no overdue family, and yes, recall scheduled. Her next appointment is her cleaning. Then we have Lauren for an Invisalign consult, so I'm assuming we'll just go over her clin check and see if she accepts treatment.
Yeah, I'll go over that. We need to take some new impressions. I saw the impressions and I want a little bit better ones on those, so I'll talk to her about that. On Sarah, we're gonna take full arch impressions with the Invisalign trays on the lower and the upper, and we're doing open tray. So I'm gonna tie those implant impression abutments together with floss, and when we take the impression, we just need Teflon tape in the room.
Okay.
Okay.
Excellent.
All right, at 8 o'clock I have Doug. He's med you, no overdue family, no past perio. Recent treatment was a crown done on number 4. We need to go over the CBCT scan today. Do you want to do that in the consult room?
I can do that in the consult room.
Okay. After the exam?
Mm-hmm.
Okay. 9 o'clock I have Kathy. She's met you, no overdue family, no past perio. Recent treatment was a crown on number 29. 10 o'clock I have Jackie. She's met you, no overdue family, no past perio. Recently you did an incisolingual on number 25. We're monitoring number 14. Yeah. At 11 o'clock I have John. He's met you, no overdue family, no past perio. Recently you did silver diamine fluoride on number 9 for some decay there.
Mm-hmm.
There is a crown pending on number 31, and then he is on a 4-month recare. At noon I don't have a patient, so at 2 o'clock I have Annie. She's met you, no overdue family, no past perio. Recently you did a bite splint for her.
Mm-hmm.
3 o'clock Frances. She's met you, no overdue family, no past perio. I kind of read through some of the notes, so I'm a little bit familiar with her medical history.
Mm-hmm.
Then at 4 o'clock, yes, at 4 o'clock I have Alex, no recent treatment. 4:30 Noah, and we just did some sealants, and they both met you and no overdue family.
Perfect. Annie's probably going back to school after this, so
Okay.
if she needs any treatment and we need to do it, we can do it at 3 because she goes to school in New York.
Okay.
Yeah.
Sounds good.
At at 8, I have Sarah. She has met you, no overdue family, no past perio, no recent or pending treatment. At 9, we've got Scott. He has met you, no overdue family, no past perio, no recent treatment, but we're currently monitoring 19 and 4, I believe. At 10, I've got Kelly. She has met you, no overdue family, no past perio. Recently, you did an occlusal on number 30 and no pending treatment. At 11, I have Tim. He has met you, no overdue family, no past perio, no recent treatment, and then I'll infiltrate for you on number 15 before he comes over.
And I have something. Kate Orschland is at 11:30. She's due for a cleaning, so I'm going to offer her that 12 noon.
That'd be really
Okay.
smart.
I think that'll work.
Yeah, that'd be good.
And then at 2, Erica, she has met you, no overdue family, no past perio, no recent treatment. We're waiting to do a buckle on 3 and 5. At 3, I have Bob. He has met you, no overdue family, no past perio, no recent or pending treatment. And recently I read in the notes he said he was thinking about doing fluoride varnish, so I think I'll talk to him again today about trying that out. At 4, Nicole, she has met you. It looks like Noah might be overdue.
Those are her children at 4.
Oh yeah, she's coming in.
With
Right.
Maddie. Yeah.
Yeah,
And
that's
then-
super fun.
No past perio. Recently you did occlusal on number 30 and no pending treatment.
Perfect.
All right, for the treatment that is due, we can guide those to Wednesday, September 4th. So it's about 2 weeks out. We have a 9:50 and an 11:20, and there's options for high production as well as filling appointments and that sort of thing. So let's fill it up, and then we'll work on those two 12 o'clock appointments.
And then as far as emergent needs go, at noon today, that'll work just fine. If something else comes over the lines, let me know. I have to go to my orthopedic appointment. I should be getting back around 2:40, 2:50. So if we need to x-ray and evaluate, let's do that. It'd be a PA, CT scan, and IOC. Just something on the hygiene side to know, since you haven't seen a couple of the patients on John. He's a really fun guy. Sometimes he can be a little like straightforward, so just so you know, really fun guy. But he did have an implant crown that we recently did for him. I want to take a double check of that because I got a letter back from the periodontist regarding that. He's aware of that back crown tooth, and he's done a lot of dentistry over the last like year and a half, so it's important to understand that. And then on the Brittany's side, on Sarah, your 8 o'clock, it's a good friend of mine, so I might take a little bit longer to talk to her. And then so you let me know when you're ready in here with the consult room with the CT scan, and then I'll peel away to do that.
Sounds
Is that good?
Okay, awesome. All right, good job.
All right, let's get it done,
Let's do
guys.
it.
Have a
Happy
wonderful
Monday.
day.
All right.